Resume.
Thank you, Mr. President. May we recognize to sponsor the measure the Honorable Senator Risa Ontiveros and to interpolate the distinguished Senate President, Senator Vicente Sotto III.
Thank you, Mr. President.
Senator Risa Ontiveros recognized, and Senate President Tito Soto is recognized.
Thank you, Mr. President. And Mr. President, yes, thank you, Mr. President. And if Mr. President, you would allow, and if the good gentleman, the good Senate President would also kindly be patient with me, may I just put something of urgent concern on the record before the good Senate President resumes his interpellation, if I may, Mr. President.
Good.
Thank you, Mr. President. In addition to the long-standing importance of preventing teenage pregnancy in the Philippines, I would just like to add, for the record, Mr. President, a note of urgency because of the additional teen pregnancies during our COVID quarantines. The UNFPA and the UP Population Institute study projects studies projected that there will be an additional 18,000 teen pregnancies under our COVID quarantine measures. This, Mr. President, already on top of the 183,967 live births from girls less than 20 years old in 2018. An example, Mr. President, of the increased teen pregnancy during our COVID quarantines, particularly in Zamboanga City. In the first quarter of this year, 2020, before the COVID quarantines, there were 493 teen pregnancies. But in the second quarter, 2020, circa COVID quarantine already, there were monitored 628 teen pregnancies, or an increase, Mr. President, of 135 teen pregnancies. This as reported by the POPCOM Regional Director, Director Reynaldo Wong. Secondly, Mr. President, pre-COVID, the 2018 civil registration and vital statistics of women less than 20 years old showed that more than 130,000 births were fathered by adult men. I say this, Mr. President, because in 2018, there were 2,250 girls who were reported mothers aged under 15 years old, vis-a-vis only 64 reported teenage fathers. Therefore, Mr. President, there is a possible 2,186 births fathered by adult men. For the 15 to 19-year-old age bracket, it was 181,717 mothers, teenage mothers, but only 50,130 teenage fathers, which showed possibly 131,587 births of teenaged girls, but fathered by adult men. And lastly, Mr. President, the trend of teen pregnancy is indeed worrying pre-COVID and in the current pandemic, because while live births of girls aged 15 to 19 years old are declining, the number of births from mothers aged 15 and below is rising from 1,381 in 2011 to 2,250 in 2018. Just for the record, Mr. President, before we continue with the interpellation, and with thanks to the good Senate President for his patience.
All right. Thank you, Mr. President. May the distinguished sponsor continue to yield for our continuing interpellations?
Yes, gladly, Mr. President.
Thank you. Well, just to address the initial manifestation of the sponsor, Mr. President, yes, we do agree to the importance of addressing the issue of teen pregnancy. And presently, perhaps in a short while, we will be able to prove that it's being addressed right now. Now, as far as the pandemic is concerned, it's exceptional. These are uncertain times. And the bill is prospective. We can no longer address what's happening now in the pandemic. But nevertheless, let me start, Mr. President.
If I may
The
also,
first
Mr.
part of my-
President, if I may, Mr. President, I thank the good Senate President for his, again, as in the previous Congress, shared concern to indeed prevent teenage pregnancy. May I also add that, of course, the bill, which I hope can be passed into law, will be progressive, and it may still address teenage pregnancy even under COVID conditions, because the World Health Organization projects that we will still have to contend with the virus for about 2 more years. Thank you, Mr. President.
All right. As I said, allow me to continue and we'll
Yes,
present
Mr.
the
President.
facts. Now, during the first part of my interpellations, August 25, I distinctly remembered, I raised 3 main concerns, among other concerns. Senate Bill 1334. These are first, the capabilities of the local government units or the LGUs in implementing the ISDN or the Information and Service Delivery Network for the AHD, Adolescent Health and Development Program in the bill. Number 2, I had also brought out the possible infringement of the constitutionally guaranteed freedom of religion and academic freedom. And number 3, the participation of the private sector in the promotion of the comprehensive sexuality education program or the CSE. After our interpellations then, I looked back at the hearings that were conducted. Hearing that was conducted in the 8th Congress, there was only one that I found. And I noticed that the resource persons and some sectors who were not invited, and mostly those who were invited, the positions that they took and the positions that they manifested are kind of vague, Mr. President, as far as my opinion is concerned. And so, by the reasons of these concerns or foregoing concerns, I sought the stand of the stakeholders relative to the same, you know, and I want to share them with the body. So, if I may have your attention, especially the sponsor, in order
Yes,
to
Mr. President.
consider the perhaps amending subject provisions of 1334 or bringing it back into the drawing board after this. Let me start first with the position of the Union of Local Authorities of the Philippines, or ULAP, relative to the point in the bill where the capabilities of the local government units or LGUs in implementing the ISDN or AHD or the Information and Service Delivery Network for Adolescent Health and Development Program. Then, also from the Catholic Educational Association of the Philippines in relation to the possible infringement of the constitutionally guaranteed freedom of religion and academic freedom. And lastly, the position of the 2 major telecommunications companies in the country, Globe Telecom and Smart Communications, on the participation of the private sector in the promotion of the comprehensive sexuality education program. All right, let me start with the Union of Local Authorities of the Philippines, or ULAP. The League of Provinces of the Philippines, LPP, and the League of Cities of the Philippines, LCP, were present in the committee hearing. However, they do not speak on behalf of ULAP, nor their position represent the unified position of the different member leagues that comprises ULAP. So I received this communication from ULAP. It is ULAP's humble recommendation that the contemplated local ISDN or AHD be subsumed under the ambit of the integrated province-wide health system for provinces and integrated citywide health system for highly urbanized cities and independent component cities. They said, we believe that creating another network in all cities and municipalities different from and outside of the said health systems may result to a necessary extra layer of bureaucracy with duplicate functions, which is inconsistent with the thrusts to enhance government efficiency and to streamline government bureaucracy. To continue, ULAP says, while ULAP recognizes that the above mentioned functions of LGUs are indeed critical and at some point even necessary to achieve the goals of the measure, we would like to respectfully convey the general unfavorable sentiments of LGUs towards proposals to include additional unfunded mandates to them. It is the ULAP's earnest appeal that the proposed additional functions and responsibilities of the LGUs come with supplementary and commensurate funding and, if possible, manpower support. In addition, Mr. President, they also suggested that the inclusion of ULAP and the League of the Provinces of the Philippines in the said Council for wider local government representation and proactive support in the body that will ensure the implementation of the policy in preventing adolescent pregnancies and the institutionalization of social protection for adolescent parents, I should say, adolescent parents. May we now find out from the sponsor what is her comment after the ULAP's position?
Yes, Mr. President. I thank the good Senate President for the additional inputs from ULAP, which we will take in addition to the expressed positions of the League of Provinces and the League of Cities. As also I expressed earlier to the good Senate President in response to the point he made that one possible course of action moving forward after this interpellation is, of course, to consider the amendments that I am looking forward to the amendments that the good Senate President will propose with the end in view of accepting as many of them as possible in order to address both the long-standing and the urgent need to prevent teenage pregnancies. Regarding the particular point of ULAP, their recommendation to subsume the ISDN into the integrated province-wide system mandated by the universal healthcare system. At the proper time, I'm willing to work together with the good Senate President to find a proper formulation that will achieve the ends of the ISDN contemplated in this bill, consistent with what is contemplated by the universal healthcare law. Regarding that this would be an unfunded mandate to the LGUs, may I just point out for the attention of our dear colleagues, in the bill under Section 23, annual allocations, upon the proposal of the Philippine Commission on Women in the committee hearing for this bill, they recommended that the GAD budgets or the gender and development budgets of both the involved national government agencies and the local government units to implement this act. So there, Mr. President, I see a space where we can look for existing funds that may be mobilized to achieve the ends of teenage pregnancy prevention. And of course, taking into account also what the good Senate President has said about the sense expressed by ULAP that supplementary funding may also be sought. And last but not the least, on the point of ULAP, that they should be included in the council contemplated by this bill. I will look with a very open mind at including that in a proposed amendment at the proper time, Mr. President.
All right, thank you. Again. Did you consult the DBM for this particular provision wherein you are talking about funding?
We invited them, Mr. President, but unfortunately they were not present at the hearing.
I'm
Mr.
sorry to hear that. Because if we don't want another spectacle of an unfunded measure.
I agree, Mr.
We
President.
we should consult the DBM first, no? Anyway, allow me to
Will
continue.
do, Mr. President.
Let me continue now. Second point. The CEAP, the Catholic Educational Association of the Philippines. The Catholic Educational Association of the Philippines, or CEAP, is the National Association of Catholic Educational Institutions in the Philippines, founded in 1941, Mr. President. They have more than 1,525 member schools and more than 120 superintendents of Catholic schools. It is a organization which operates through regional educational associations located in 17 regions of the country. And we deemed it necessary to find out from them so that they consulted their schools, they consulted their members, and we received the communication from the National Secretariat of CEAP. For the record, Mr. President, out of the 1,520 presently member schools, to name a few, they are Colegio de San Juan de Letran, Pedro Poveda College, University of Santo Tomas, Adamson University, Ateneo de Manila University, Claret School of Quezon City, Colegio de San Agustin, Holy Spirit School, De La Salle University, College of St. Benilde, Don Bosco School, La Consolacion, Lourdes School of Mandaluyong, Miriam College, San Beda College, Southville International School, Xavier School, St. Paul College and University, St. Scholastica's College, and 1,502 others. Now, this is the position, Mr. President. The CEAP member schools, according to them, I'm quoting from their letter, the CEAP member schools have already integrated in their respective curricula the necessary age and development appropriate reproductive health education to adolescents and is being taught by adequately trained leaders or teachers pursuant to the previously enacted law RA 10354 or the Responsible Parenthood and Reproductive Health Act of 2012, which was a complete package originally authored and sponsored by Senator Pia Cayetano. The CEAP expresses its serious reservations essentially for the following reasons. One, SB 1334 already covers a subject matter that has been comprehensively covered by already existing laws, namely RA 10354 or the Responsible Parenthood and Reproductive Health Act of 2012, as well as the RA 9710 or the Magna Carta of Women in 2009. According to them, passing this measure would only be a redundancy and may very well cause confusion on how to properly implement measures relative to adolescent reproductive health education. SB 1334 already covers a subject matter that has been comprehensively tackled by existing laws, namely RA 10354 as well as RA 9710. That's their first point. The second point of the CEAP, the concept of a standardized comprehensive sexual education, or CSE, mentioned on Section 6 of the bill pays scant regard to a school's respective identity, vision, and mission, which plays a very crucial role in how these schools implement the provisions of RA 10354. And this measure, if this bill is passed, the compulsion to teach a standardized CSE may also conflict with the academic freedom constitutionally enjoyed by these higher education institutions. So for SIAP member schools, according to them, their Catholic identity, as articulated in their vision and mission, is the very nexus of the instruction and formation of their students. It therefore becomes a very problematic issue for our member schools when a standardized instruction, especially on matters of human sexuality, is being mandated by the state. Also, if no appropriate government funding is given to the private establishments that are supposed to implement this, including our member Catholic schools, it becomes an unfunded mandate, pretty much what the LGUs are saying, and an unreasonable restriction on how our member schools implement what is already existing, the existing provisions in RA 10354. Third position of the SIAP, there also appears to be a punitive aspect in Section 6 when it asks for the DepEd through a Philippine accreditation system for basic education board to review the accreditation of schools that are not complying with the provision and delivery of CSE. And while there is such a provision that monitors compliance for basic educational schools, no such counterpart exists for institutions of higher education. It is silent on whether the CHED and the TESDA will also do the same for institutions of higher learning. SEAP continues also to question why accreditation is being used as the tool for guaranteeing that schools will comply. So they're asking, is it now mandatory? When accreditation is a voluntary process undertaken by schools in order for them to achieve levels of excellence not otherwise achieved by simply maintaining the minimum standards being regulated by government through the DepEd. Fourth position of the SEAP, Section 12 of SB 1334 provides that reproductive health services may be availed by adolescents from trained service providers in public and private facilities, including school clinics and school-linked health centers. That's part of the bill. So according to them, and they quoted that, to continue what they're saying, not only does this provide a certain level of concern for our member Catholic schools that need to adopt a plan on how to properly implement this, which can at the same time be harmonized with the basic Catholic principles on human sexuality. But more importantly, and on the secular level, it already conflicts, or if it does not, it overreaches, as it already includes school clinics and school-linked health centers, and likewise excludes the participation of the minors' parents in decision-making. Unlike that found in Section 7 of Republic Act 10354, which provides that family planning services shall likewise be extended by private health facilities to paying patients, period. That minors will not be allowed access to modern methods of family planning without written consent from their parents or guardians, except when the minor is already a parent or has had a miscarriage. SIAP also requests that the access to reproductive health services be slightly modified in the sense that the role of the parents of the adolescent who is sexually active should not be excluded from the contemplation of the law. At the end of the day, that adolescent is still under the supervision of her parents. Fifth position, mahaba yung sulat nung CF eh. Section 13 of Senate Bill 1334 provides that discriminatory and exclusionary practices that harm and discourage the education of adolescent parents shall be prohibited. In truth, this concern has already been addressed by an existing provision in our Magna Carta for Women and even clearly stated in Section 13 of Republic Act 9710. No school shall turn out or refuse admission to a female student solely on the account of her having contracted pregnancy outside of marriage during her term in school. In fact, other provisions in RA 9710 also lend support to Section 13 thereof when it prohibits discriminatory practices against women. The provision in Section 13 of SB 1334 is already superfluous and may even create a new myriad of problems for schools insofar as there is no vagueness in what there is vagueness in what discriminatory and exclusionary practices are and to what extent it is being harmful and discouraging to the education of adolescent parents. The provision above quoted ought not and should not be used as a shield too when a student has to be meted out sanctions, suspension, or expulsion if the said student is found to have violated other provisions in the school's disciplinary handbook. This is the reason why we find that provision in the proposed bill to be very problematic. And they continue. To illustrate this point, an adolescent student who was found to have committed a sexual act under scandalous circumstances and therefore a violation of the school's handbook for immorality cannot use her pregnancy as a shield from the consequences of her actions. While Catholic schools employ compassionate justice in deliberating on disciplinary cases like these, there are still circumstances, as exemplified by the illustration, where sanctions have to be meted out. That is the point being raised by the Catholic Education Association of the Philippines. May we find out from the sponsor why they did not invite these Catholic schools in the hearing?
Ibita ba natin yung Isaiah? Because?
Wala. Wala eh.
I see. Mr. President, I thank the good Senate President for laying out the 5 points of the Catholic Educational Association of the Philippines. And I was happy to hear the initial roster of members, including my 2 alma mater, St. Scholastica's College, Manila, and the Ateneo de Manila University. Unfortunately, SEAP was not invited to this hearing in the 18th Congress, 17, because apparently they were not on the radar of the committee. But since we are now in the period of interpellation, and I hope to move forward eventually to the period of amendments, I am happy to address their concerns here on the floor. Gaya ng sinabi ni Senate President, mahaba yung sulat nila, and this can only help to further improve the bill. To the first point of SEAP, that the comprehensive sexuality education has already been integrated, is already being taught by trained teachers, and that there might be a redundancy or confusion. Indeed, Mr. President, while the Responsible Parenthood and Reproductive Health Law already wrote CSE implementation into law, much work has to be done. For instance, DepEd, the main agency in CSE implementation under the RPRH law, was still conducting their workshops on the finalization of policy and implementing guidelines on CSE as late as September 2017. There had been an impression from one of PLCPD's consultation meetings that the pace of DepEd's implementation had been slow. And therefore, in order to assist this process and to accelerate it from its current slowness, therefore also there is that provision in the current bill, Mr. President, about the training of teachers, guidance counselors, and school supervisors on CSE. A 2018 UNAIDS Guide on Sexuality Education reports that competent teachers who have achieved a comfortable level with the subject has been associated with an increased likelihood that they will deliver health and well-being programs with high fidelity and quality associated with positive impact on the students' reproductive health behaviors. So that is one response I could make, Mr. President, to this initial concern expressed by SEA. Moving on for now to their second concern, that this would become under the current bill standardized CSE. It would not be standardized, Mr. President, because also in faithfulness to the spirit of the RPRH law, what would be mandated is age appropriate and development appropriate comprehensive sexuality education. And of course, in every particular school setting, given the charism of the school or the tradition of the school, its particular worldviews and approaches to the different issues faced by young people growing up and in the formal education sector, the core CSE content as prescribed by DepEd and CHED would be adapted to the particular school setting. Regarding the conflict with academic freedom, there is no intention at all to attack any of the constitutional principles, including this one. And I would, additionally, Mr. President, since the good Senate President mentioned earlier the concern about religious freedom at the proper time, I can accept an amendment adding explicitly respect for our religious freedom. And then to the third concern, I'm sorry, Mr. President, still on the second concern of SEA on the unfunded mandate, again, I wish to reiterate that precisely section 23 of the bill on annual allocations recommends that the GAD budgets of the national government agencies and LGUs be used to implement this act, thereby preventing that it become merely an unfunded mandate. And as to unreasonable restriction, again, wala pong intensyon yung panukala na mag-exercise ng anumang unreasonable restrictions sa ating mga paaralan. To their third concern, Mr. President, that the bill would be punitive because it is mandatory. I am sure, Mr. President, that the good Senate President also is aware that when it comes to bills that this representation sponsors, one of the sections that I am most open to considering amendments to would be the section on penalties. So I'm willing to work with him on finding acceptable language that reflects both the sense of the Senate about implementing effective programs on important and urgent issues like teenage pregnancy without being overly punitive or while being as liberal as possible on this aspect, Mr. President. To their fourth concern of SEA, on the reproductive health services, that this may lead to conflicts or to overreaching, that it may exclude the participation of parents, and that parents are not included or would in effect be excluded from the implementation of this law. In fact, Mr. President, the bill speaks of the role of parents and guardians inside and outside the schools through through Section 8, comprehensive sexuality education for parents and guardians. Learning also, for example, Mr. President, from a report from the United Kingdom, which stated that engaging parents made a big contribution to their goals. The UK's Teen Pregnancy Prevention Plan also included holding schools responsible to involve parents in the students' SRH education and implementing local SRH programs like Speak Easy sessions for parents and guardians. It is known by all of us, parents as well, that families and peers are influential in shaping beliefs, attitudes, and behaviors of young adolescents, especially in their SRH. And it is for this and other reasons, Mr. President, that medically accurate CSE for parents and guardians is highly encouraged. Kasi po, Mr. President, if myths and misperceptions make up the sex talks between parents and our children, parents would risk endangering our children with misinformation that may result not only in unintended pregnancies, but also our children being infected by sexually transmitted infections, even HIV and AIDS. On the other hand, Mr. President, positive family relationships, particularly communication about sexual behavior and romantic relationships, connectedness, and family cohesion have all been associated with reduced teen pregnancy and delayed sexual debut. So for this and many other reasons, Mr. President, indeed, itong panukalang batas natin not only welcomes or accepts but embraces and encourages yung partisipasyon ng ating mga magulang inside and outside the schools, including through comprehensive sexuality education of our children in order to reduce teenage pregnancy, Mr. President. And last but not the least, the fifth concern of SEAP, of course, without prejudice to returning to any of these points as the good Senate President may wish, they're concerned that discriminatory and exclusionary practices are prohibited, asking to what extent they are harmful. Of course, Mr. President, I am sure nagkakaisa po tayong lahat dito sa Senado na any discriminatory and exclusionary practices against any Filipino citizen, lalo ng ating mga anak, would indeed harm them. So the concern, to continue, Mr. President, of SEAP, that this is already included in the Magna Carta of Women. And yes, indeed, Mr. President, so there is no harm in, at higit pa doon, it could bear repeating or affirmation in the bill. And also the concern of SEAP that the sanctions would be, or rather the sanctions of schools under their student handbooks would be prohibited, even regarding scandalous behavior, and yet citing the spirit that most, if not all, schools seek to practice of compassionate justice vis-a-vis their students. Regarding this fifth and last point, Mr. President, I would venture to say na kung gusto rin natin na maging mas maluwag at hindi punitive sa mga usapin ng mandatory requirements sa mga paaralan, sa usapin ng accreditation, that we could also adopt an equal or a commensurate, precisely spirit of compassionate justice vis-a-vis any of our children or any of our students na maaring malagay sa sitwasyon ng teenage pregnancy, para to allow them every opportunity, even after they give birth, even while as teenage parents they are taking care of their child na bumalik at magpatuloy at makapagtapos sa sa pag-aaral para maghanda sa decent jobs at maghanda sa maayos na pagtaguyod ng kanilang pamilya. Having said that, Mr. President, of course, again, we can amend the particular provision to make it clear that the discriminatory or exclusionary practice would be based on pregnancy, to be specific about that and not to embrace any scandalous or other prohibited behavior in the school's students' handbook. For the record, Mr. President, regarding how discriminatory and exclusionary practices indeed harm our teenage parents, consequences documented consequences of the expulsion of pregnant students would be they may be forced out of their homes and may end up living on the streets, where they may be forced by circumstance into commercial sex work. So worse, going to worse, from the frying pan into the fire. Pangalawa, Mr. President, this may force them into early marriage, even against, or rather facing the fact, Mr. President, na yun na nga, underage pa po sila para sa isang seryosong responsibilidad tulad ng pag-aasawa. And last but not the least, Mr. President, this would discourage their return to school, lalo na po sa mga estudyanteng mahihirap. So lalo pong ma-exacerbate yung cycle of intergenerational poverty, Mr. President.
My opinion, Mr. President, is that, Your Honor, is that the last concern that the sponsor mentioned is being addressed by the RH law. Now, Section 8, I looked at Section 8 that she mentioned, the distinguished lady mentioned about the participation of parents. Capacity building ang sinasabi dito, pero there is no direct participation of the parents to agree on the CSE, or the formulation. Wala doon eh. Yun ang sinasabi ng SIAP. Now, the explanation given to us, how I wish, Mr. President, that the distinguished sponsor explain this to SIAP, not to us. You know, what we're hearing now, I doubt if a majority of the members of the Senate agree to what they're hearing now. The explanation be given to them, because they're the ones that are saying that this is how they look at the bill, and I tend to agree with them. And that is the reason I asked for their opinion. The ULAP, the SEAP, the Catholic. We're only 22, 23 members here listening to this. But there are 1,520 Catholic schools that will be affected. And they do not agree, Mr. President, to the contents. Now, all right. Tabi na muna
Mr.
natin,
President,
because
if I
the
may,
sponsor is ready. Wait,
yes.
allow me to finish, please. The
Yes, Mr.
sponsor is
President.
ready to accept amendments according to her. So, tabi na muna natin, because again, what they are saying is that their main concern is that the bill is redundant to RH law. If the RH law is not being implemented well, then we should ask them to implement the program well. Now, let's move on, because as I said, the explanation should be addressed to these associations or these members of the associations. As a matter of fact, I'm surprised that if there is a big chunk of the bill concerning sexuality education, we should have at least referred this measure also to the Committee on Basic Education, and more so the Committee on Higher Education. I wish I could find out from the members of that committee or the chairman of that committee their position on the matter. So perhaps that is another let's say a road to take. Ask the two committees to look into this particular matter, because this is this is a not just a large but exceedingly high point being raised by Catholic 1,500, more than 1,500 Catholic schools, Mr. President. All right. So now,
Mr.
as I said,
President,
the
just to put
sponsor is
on
ready to
record,
accept amendments. I will move on. Unless,
yes,
yes.
Mr. President. I just like to make of record that I would gladly write to the SEAP. In fact, I have been invited to speak at symposia, and I have been doing so in the past several years since the passage of the RH law, precisely regarding the implementation of comprehensive sexuality education, not only in my alma mater, but in various schools. So gladly taken, Mr. President.
All right. Thank you. Now, let's set that aside and address it at the proper time, which at this point I suggest that the committees on higher education and the committees on basic education be consulted. On the third point, during the August 25 interpellation, from the telecommunications companies, we asked them for their opinion, Mr. President, because the hearings that they participated in, if I'm not mistaken, was in the 17th Congress. The 17th Congress. So we asked them on their perspective on SB 1334. Let me start with the Smart Communications Incorporated. In the Smart Communications letter dated September 3, 2020, just recently, this is their company's stand on Section 11 of Senate Bill 1334. They say they support the government's commitment and mandate to provide Filipino adolescents full and comprehensive information and access to educational materials in respect of their sexual and reproductive health and care. However, ayun na mabigat no? Yung however. However, the promotion of CSE may prove difficult to operationalize, mainly because the company is unable to determine and narrow down the intended recipients of the CSE. This is due to the fact that a large majority of the network's subscribers are prepaid users, and because there is yet no legal requirement for the registration of prepaid SIM mobile numbers, the company is effectively blind to the user's profile, including their age. To quote Smart's in concluding statement, forward ko na, concluding statement nila, while our participation in this initiative would be highly effective if the goal is to reach as many people as possible, regardless of demographics, we cannot say the same for targeted messaging, which may not be appropriate for sending to all subscribers in view of their sensitive content. All right. Moving to Globe Telecom Incorporated. While Globe, ito sa kasama na sa sulat nila ito. While Globe interposed no objection on the bill during the previous Congress when it was introduced and discussed on the floor, Globe Telecom Incorporated stated in its September 8, 2020 letter, mas recent pa ito, that, I quote, after a more careful scrutiny of the refiled bill and in light of the existing health emergency caused by the COVID-19 pandemic, there is a need to reassess our position on the matter. The following reasons and statements were given by Globe to substantiate its apprehension on its participation or involvement in the promotion of comprehensive sexuality education provided in Senate Bill 1334. Mr. President, this is, again, to continue Globe's message. There is a surge in demand for connectivity, for working from home, online learning, telemedicine, e-government, enabling contactless payments, and generally, due to the digital transformation that is unfolding before us. All of these activities have severely strained our networks, necessitating the the expenditure of substantial capital to improve the network and roll out more telecommunications infrastructure. Hence, at this point, and perhaps for the long term, as we beef up our own network for the new normal, private participation in the promotion of CSE is not feasible. Continue. SMS contributes to the congestion of the network, which also causes the perceived poor quality of connectivity in the country. They also say, targeted SMS to promote CSE will be better achieved in a regime where all SIM cards are registered, since roughly 95% of mobile phone subscribers are prepaid cards. It is next to impossible to deliver targeted messages. The receipt of unwanted messages is among the complaints raised by subscribers against telecommunication companies. As crafted, the incentives promised to the private sector for participating in the promotion of CSE is vague, opaque, and too general to attract private sector participation. Moreover, the incentives dangled in Section 11 runs counter to the current thrust of the government to rationalize incentives. And finally, they say the CSE information overload through various channels may be counterproductive in the long run, as this may tend to numb the target audience to the point of filtering out such CSE information. With that, Mr. President, the sponsor might want to react before I
Yes, of
continue.
course. Yes, thank you, Mr. President. What we know, Mr. President, is that when we consulted both Globe and Smart, and the good Senate President is correct, this was during the 17th Congress, at that time they interposed no objection. But now, if in response to the good Senate President's query, they have changed their minds, Smart saying that this may prove difficult to implement, and Globe saying that it is not feasible, then we are happy to amend our bill. What we are leveraging simply, Mr. President, is global experiences on, in fact, the successes of telecoms as platforms for CSE education. At sana nabalitaan din nila yung sinabi ko sa simula or sa pagpapatuloy ng ating interpellation, how much more urgent, in fact, the participation sana of the private sector could be to address preventing teenage pregnancies precisely under pandemic quarantine conditions. And also, just for the record, Mr. President, though misperceptions, misinformation, and myths exist in the digital realm, it also provides an avenue for correcting such misinformation. Social media and ICT have an enormous potential to provide a direct, anonymous, and non-judgmental information on sexuality and relationships. And lastly, Mr. President, I spoke earlier about leveraging global experiences. As I mentioned in the previous interpellation, and I think it is still illustrative now, yung mga successful examples na nabalitaan natin sa Rwanda at saka sa Cote d'Ivoire. They both used mobile for reproductive health or accelerated school pregnancy reduction plans using interactive messaging system, using a phone line. And these reached mobile phone users with information about puberty, preventing sexually transmitted infections, and preventing unintended pregnancy, and where to find health services. They provided referrals to health services and health centers. And in addition, health information and services will be disseminated through SMS messaging. But so ganun po, Mr. President, kung nag-iba na po yung kaisipan nung dalawang kumpanya mula nung nakaraang kongreso hanggang ngayon, as I said earlier, I will be happy to amend our bill, Mr. President.
Yes, thank you, Mr. President. Well, of course, we are expecting that. But I'm not surprised because the Smart Communications and the Globe Incorporated,
Excuse me.
I'm not surprised that they changed their minds. Only fools do not change their minds because they were not well appraised of what it's really the content. No? Kaya ang sagot we have interposed no objection. Nung araw yun, ibang usapan eh. Iba't saka hindi naintindihan masyado, Mr. President. Ngayon naintindihan eh. Naintindihan yung what entails sa kanila. Ano, hindi nila alam anong incentive, ano laman ito. In much the same way that I am seeking now the position of the DepEd. Kaya sabi ko, we should consult the Basic Education Committee and also the Higher Education Committee on this. Because we asked the DepEd for their position. The position that they placed or that said in the hearing, and we reviewed the hearing, was kind of vague. It didn't really say that all the contents they approve. Parang in principle, ganun yung mga binitawan. So I'm seeking the position of the DepEd now. We have not received it yet. We have not received from DDM. And then perhaps, may I find out from the sponsor if you consulted the Department of Finance on this matter because of the incentives that you are going to give the private sector?
We did not, Mr. President.
All right. So again, I think we should go back to the drawing board and find out from the Department of Finance their position, the Department of Budget their position, and then our two other committees on the matter. So when we receive that, perhaps we will be ready to propose any action or amendments to the measure. At this point, Mr. President, I suspend my interpellation and await the provisions or the positions that we are seeking. Thank you. We thank the distinguished lady for answering our questions.
Thank you, Mr. President. I will continue to be ready to answer any further questions as well as, of course, from the other colleagues, Mr. President. I wish to reiterate yung sinabi ko po sa simula nung pagpapatuloy ng ating interpellation na there is an additional sense of urgency now na nasa ilalim tayo ng mga pandemic quarantine conditions na itatala na ng POPCOM, yung tumataas na incidence ng teenage pregnancy sa ilalim nitong mga quarantines, and we could perhaps get other subnational data aside from what I presented earlier from Zamboanga City, at lalo na humaharap tayo sa posibleng 2 taon pa nitong pandemic and on and off periods of time na baka kailangan nating self-impose na mga quarantine sa ating mga LGUs. I think that our young people, our teenagers, will still need the benefit of such a bill. And of course, even after the COVID-19 pandemic, approaching as it seeks to the prevention of teenage pregnancy mula hindi lamang sa mga national experiences natin so far sa pagpapatupad ng mga naunang batas tulad ng responsible parenthood and reproductive health, pero yung mga leksyon din ng ibang mga bansa which successfully through partnerships among parents, teachers, local government units, and national government agencies successfully help prevent teenage pregnancies, to give their children, to give their students that much more strong chance at a good education, decent jobs, and quality family lives. So maraming salamat po sa good Senate President, and maraming salamat din po, Mr. President.
Mr. President,
Senator
I may.
Lima.
Thank you, Mr. Presiding Officer. Thank you. We'd just like to make a short manifestation. Mr. President, we recognize the valuable points raised by no less than our Senate President, and we value all the concerns that he has brought to our attention, especially, Mr. President, the issue on religious freedom and education, particularly in the technical vocational education and higher education. As chair of the Committee on Higher Education and Vocational Education, we'd like to put on record that we are committing ourselves to studying further this measure, and we will, at the proper time, introduce amendments, if not ask further questions. Thank you, Mr. President. Thank you, distinguished sponsor.
Thank you. And likewise, Mr. President, same with the comment of Senator Joel as the chairman of the Basic Education Committee. I was looking through the bill, and basic education plays a major role in the activities of this bill. We're also committed to review the bill and also work with the sponsor and the Senate President on the concepts of the measure, Mr. President.
Thank you, Mr. President.
Thank you, Mr. President.
Thank you, Mr. President. Before we suspend consideration of the measure, I do believe also, and I'm sure the good sponsor will agree with me, that if we want to deter teenage pregnancy, we must really seriously look into considering the lifting of the statutory rape age. I've been saying that, I've been championing this from day one. Our statutory rape age, Mr. President, is the lowest in the world. We only have another one at 12 years old. There's only one other country that has the same age, which is, I think, an African, Central African country. Ghana, I'm not sure if it's Ghana or I don't know which country in Africa. But there's only two countries, the Philippines and that African country. Everybody else has raised it to an average of 16 years of age, Mr. President. In other countries where it's 16 years and above, obviously, they always joke about when you date a younger person, it's always jailbait. Makukulong ka niyan, no matter what, no? So that's a deterrence. And that's why I'm happy that there will be a hearing about that bill. And I hope I can get the support of all my colleagues. I think any decent chamber, whether it's legislative or parliamentary, will agree with me that we really have to increase the statutory rape age in our country. And that goes for men and women, because there are actually young boys that are raped, and you know, the penalties are just lasciviousness and you know, it's bailable offenses. So kawawa itong mga kabataan na to. Senator Angara, I think Mr. President would like to be recognized.
Thank you, Mr. President. And that's another priority measure that we also need to tackle, Mr. President. I'm likewise an author of that bill. It's called the Anti-Child Rape Bill. And it's
Yes.
really about time to update our antiquated laws on child rape, Mr. President. And I join the good majority floor on that advocacy.
Thank you, Mr. President. Mr. President, may we recognize Senator Sonny Angara, after which Senator Amy Marcos.
Senator Sonny Angara is recognized.
Thank you, Mr. President. I'd like to support the majority leader in his quest to regulate some of these things, because he is the acknowledged expert on dating young members of the fairer sex, Mr. President.
I knew that was coming, Mr. President. Unfortunately, I knew that was coming. But you know, to counter, I would just say that stands as a warning to our single members of the Senate. And there's only one single member at this point in time, so he can no longer he can no longer date, rather, teenagers, Mr. President. Mr. President, Senator Amy Marcos would also like to be recognized.
Yes, thank you very much, Majority Leader, and please count on our support. I also authored a similar bill simply to raise us to the global level of at least 18 years old. This is a disgraceful state of affairs, particularly in the context of the rise in child online pornography, for which the Philippines has become the epicenter of the globe. Thank you.
Thank you for that, Senator Amy Marcos. Senator Risa Ontiveros, Mr. President, would also like to be recognized.
Yes.
Senator
Senator
Ontiveros.
Ontiveros is recognized.
Thank you, Mr. President, and thank you so much to the good majority leader for raising that point at this time that we are discussing various bills regarding our children and young people. I'm also an author of a bill, a similar bill, raising the age of consent and in effect expanding the protection, yes, against statutory rape for our children aged 13 to 17 years old. And in fact, Mr. President, I just like to manifest this on the floor that I'm formally, I thank that those bills are in the very capable hands of our good chairman of the Committee on Justice. And as the chair of as a member of that committee, not just the chair of the Committee on Women, but as a member of that Committee on Justice and as a principal author of the bill, I will in fact formally request the good chair of the Committee on Justice if he would consider to form a subcommittee and allow me and allow other authors to try to accelerate our deliberations on those bills. Indeed, as in the matter of preventing teenage pregnancy under pandemic and quarantine conditions, there is an additional urgency about this, Mr. President. And additionally, urgency also because it has moved forward in the House of Representatives. So that's wonderful news from our counterparts in the House of Reps. So thank you very much, Mr. President, good majority leader, and the other colleagues who are championing children's rights. Salamat po.
Thank you, Mr. President. Thank you, ma'am. Absolutely. I believe Senator Gordon is already scheduled a hearing for it. We just don't know what date. I could see Senator Ralph Recto listening intently to the conversation on this issue. Maybe he would like to comment. No, maybe not, Mr. President. Mr. President, with that, I move to suspend consideration of the measure.
Is there any objection? Senate Bill number 1334 suspended.
Mr. President,
Thank you,
before we
Mr.
adjourn,
President.
I'm sorry. Thank you, Mr. President. Thank you, Madam Sponsor. Mr. President, before we adjourn, just some housekeeping matters. With the permission of the body, I move that we proceed with the Senate President's designation of the Senate conferees to the Bicameral Conference Committee on the disagreeing provisions of Senate Bill number 1520 and House Bill number 6756. This is the Act establishing medical scholarship and return service program for deserving students. Mr. President, would you designate the members, Mr. President?
Mr. President, the Senate President has authorized me to name the following members of the Senate conferees to the Bicameral Conference Committee on the disagreeing provisions of Senate Bill number 1520 and House Bill number 6756. And the conferees are Senator Joel Villanueva as the chairperson, Senator Nancy Binay, Senator Angara, yours truly, Senator Gatchalian, Senator Risa Ontiveros for the minority.
Thank you, Mr. President. With that, no further agenda today. I move that we adjourn session until 3 o'clock in the afternoon tomorrow. That's Wednesday, September 16, 2020. Before we adjourn, Mr. President, Senator Franklin Ron would like to be recognized.
Parliamentary inquiry, Mr. President, would the Office of the Majority Leader already have a listing of the possible agenda starting on Monday, Tuesday, and Wednesday next week to enable us to prepare? Because I noticed that more and more bills are being reported out, which is good, but in fairness, give us a little time to study these bills. Otherwise, we will be asking for deferment on the scheduled consideration of the measure. So may we be allowed, maybe be given the information on the bills that will be on the calendar next week.
As of the onset, Mr. President, I just conferred with my legislative staff. Nothing yet in particular except for the major ones that we mentioned earlier, Mr. President. That's the CREATE bill. We'll also be finishing up also our Coco Levy measure of Senator Cynthia Villar. The measures that were sponsored earlier also by Senator Joel, which are the freelancer bill, and but we'll furnish a copy, Mr. President, hopefully by the end of the week to Senator Julon's office and
Yes.
colleagues.
Mr. President, we hope that
Personal session na.
a good office of the majority leader can space the or yes can give us enough pace or spacing in order that we can have sufficient time, not on every bill but on the very critical bills. We know what these bills are, to give us more time to study it. That's all our request, Mr. Chair.
We'll do, Mr. President. We will release a list by Thursday, Mr. President, for everyone's perusal. So with that, Mr. President, I move for my previous motion to adjourn session till tomorrow, 3 o'clock in the afternoon, Wednesday.
Is there any objection? There being done, the session is adjourned until 3 o'clock in the afternoon of Wednesday, September 16, 2020.
Thank you very much. Good evening, everyone.